Good afternoon, ladies and gentlemen. It's me, Dr. Richard Arjun Kaul again, and I'm here today to talk about medical innovation and the fact that nobody likes going to a doctor. I mean, I really, being a doctor myself, over the years I've come to understand the fear with which people walk through the front doors of a doctor's office. And so anything that we can do in terms of developing technology, devices, coming up with ideas to keep people away from doctors, I support. And even though it will probably put me out of work, I think it's a great thing. The other area of medicine that has always fascinated me, and a lot of people, is the futuristic devices that people think about, that they would see on Star Trek and other shows, and they would wonder to themselves, are these things ever going to appear in our life? Now, I had these questions, these thoughts, and the other day I went to, or was invited to, a very small meeting with a very small French company. The French are very creative, I must say. Come up with some great ideas. And the company has come up with this device. It's called a pseudoscan. And what it is basically a completely non-invasive way of assessing and measuring people who have diabetes. Now, at the moment, a person who's diabetic and has been diagnosed as diabetic will be monitored periodically by having their blood taken, and will go into a clinic, the blood will be withdrawn, and there'll be certain markers or elements in the blood that the physician will keep an eye on. So, these poor patients have to submit themselves periodically for the rest of their lives to go into these phlebotomy clinics, and I can assure you, after a vein has been punctured 100 times, it gets harder and harder to get that needle in. Now, these bright minds in Paris came up with the idea that, there has to be some way of working out what's going on with a diabetic patient without sticking a needle or a probe into them. So they started to look at what's called the autonomic nervous function. Now, the human body has many nerves. There are nerves that are called sensory nerves, and they provide sensation to the arms and the legs. There are nerves that are called motor nerves, that provide motor function to the muscles. They allow the arms to move, the legs to move, the body to move. And there's a nervous system, or part of the nervous system, that's kind of like it's a little bit more subtle. It's kind of like the underground version of the nerves. It's called the autonomic nervous system. Now, it's a very critical part of the human nervous system. Without it, humans would not be able to survive. And these are very, very small, fine fibers that twist in and out of every cavity of the body. You find them everywhere. Now, there's two parts to the autonomic nervous system. There's the sympathetic and there is the parasympathetic. And without going into the boring anatomical detail that I had to absorb for months at medical school, what the French designers did was they said, if we're able to come up with a device that, when placed over a specific area, will pick up the electrical impulses coming from these autonomic fibers, we're going to be able to make associations between that, sweat gland activity, and what's happening to the diabetic. So they started to look at sweat glands, and the sweat glands being the closest glands to the skin, to the epidermis. And surrounding the sweat glands is a little plexus of these autonomic nerves. And in diabetics, what happens is these nerves start to degenerate prematurely, which means they start to get thinner in diameter, their concentration starts to decrease, and if left for long enough, they will completely disappear. And when you examine patients who've been long-term diabetics, they are unable to produce sweat because their glands have completely disappeared. So what this company said to itself was, what we would like to do is to be able to predict beforehand people that are going to develop frank or full-on diabetes, so that we can start to treat them prophylactically and prevent the sugar going up high and the end organ damage that occurs in diabetics. Now, being obviously a man of science myself, I looked closely at their papers and spoke to a number of their scientific officers, and it fascinated and interested me significantly, because I see it as the beginning of the new wave of medicine, this non-invasive diagnostic techniques that rely essentially upon the electromagnetic fields that surround the body. Now, we as human beings, we walk around every day and, we don't give too much thought to anything that's either too spiritual or a little bit too esoteric, because we're concerned about paying our gas bill, our food bill, and keeping the wife or husband happy. But when you think about it, humans are basically walking or mobile units of electromagnetism. We're all electromagnets. The Earth is a huge magnet. Humans are, smaller versions of those magnets. And we all give off a very unique frequency. There are differences between individual humans in terms of the type of electromagnetism, the frequency, the rate. So what the device honed in on was this. It said, we're going to come up with this device. We're going to come up with various logarithms, which they had their computer guys develop. We're going to come up with a couple of foot pads and hand pads, which will be able to detect the electromagnetic fields in the hands and the feet and make correlations as to where that patient is on the diabetic scale. Now, when I went to meet with these people, they had the device there and they had the pads, and I got to witness a first-hand demonstration of how it works. And I must say, I'm not easily impressed, but this device did raise my levels of interest, and I did see it work and understood the thinking and the physiology behind it. But what was more significant to me was what it means for healthcare and for medicine going forward. And I started thinking about Star Trek and Captain Kirk and the Starship Enterprise, and how they used these scanners and these devices to, one, diagnose what was going on with a person's body, and two, treat it. And as I thought about this more and more, it didn't seem so surprising to me, because in a way these therapies have been around for centuries. And so when you go back to ancient India and ancient China, and you look at the Ayurvedic techniques and Reiki, and you understand that actually these forms of ancient therapy were based exactly upon that, were the modifications of energies. They called them, the Chinese refer to them as meridians, and that's the basis for modern day acupuncture. They are able, or the Chinese practitioners are able to detect if there's an abnormal flow in certain meridians, if there's a disruption of energy in the hands or the feet or the ear. And they were able, over the years, to correlate very detailed charts which connected the hand, the foot, the ear, with all of the different parts of the body. And so, for example, if you were a patient in ancient China and you'd had one too many to drink the night before and some bad noodles, and you went in to see your practitioner, he would understand that you had indigestion. But he wouldn't give you any tablets to put down your throat to help you with the indigestion, which is what we do today. What he would do is he would identify the parts of your ear that correlated to the stomach and the small bowel, and he would use a number of techniques, whether it was digital pressure, a small needle, or a warm stone, and he would apply pressure to that point. And there would be a realignment of the energy. And what would happen is that the symptoms that the patient was experiencing would disappear. So that thinking has been around, and unfortunately, for political and economic reasons, it was sidelined. However, it seems to have made a comeback. You know, the good always comes through. But this time, we've got technology to objectify it, because one of the big criticisms that came from Western medicine practitioners with regards to these Eastern techniques was that it was not scientific enough. There was nothing objective about it. Well, these devices have begun the objectification of these conditions, and I anticipate that there are going to be more of these used across a greater degree of conditions. So say, for example, patients who have chronic pain conditions. You know, these devices can be used to help diagnose and treat chronic pain conditions. Patients with cancer. You know, the ideal, or the gold standard is if we can pick up the first cancer cell, if we can detect what's going on early on, then we can do a lot more to help that patient than relying upon tests that only detect it once it's got to stage 2, 3, or 4. So, you know, I would like to say, you know, congratulations to this company and to the scientists, and I would say to the public, keep an eye out for these innovations, because this is the way that medicine is happening, and it's going to be, you know, the future of Star Trek is actually almost now. So, thank you.